A significant portion of those infected with the new coronavirus may not show any symptoms at all. And even in those who develop symptoms, the majority of cases will be mild. But we also know that some people get severely ill from COVID-19. So why do people react differently to the virus? And which category do you fall under?
It is thought that it is really the overdrive of the immune response that's leading to the severe cases of COVID-19.
Dr. Iwasaki and her colleagues are trying to decipher the difference between a protective versus a pathologic immune response to COVID-19.
In a normal immune response, what happens is that the immune response kicks in and it starts to recruit cells from the blood, known as the white blood cells, to clear the virus. But in certain patients, what we're seeing is that the immune system actually goes into overdrive. Instead of simply getting rid of the virus, the immune system starts secreting cytokines, and this is known as the cytokine storm. And instead of helping the host cope with the infection, the cytokines actually can cause damage to the tissue, such as breaking down protective lining of the lung and the blood vessels.
These cytokine storms were historically responsible for many deaths during the 1918 flu pandemic and other viral outbreaks, and they're probably behind the most severe cases of COVID-19.
Right now, we don't understand what kind of immune responses are needed to recover from the infection versus what types are driving the disease itself.
Although the results are preliminary, her team's research has already unearthed important clues.
We are seeing elevated cytokine levels in the blood in the patients that go on to progressive disease compared to those that recover from the infection. The other thing we're seeing is that lymphocytes acquire this exhausted phenotype in the patients that go on to progressive disease. And ultimately, the lymphocyte becomes depleted from the patient. And that is obviously not a good news because a person becomes immunocompromised at that stage. So we're trying to understand how these things happen in the COVID-19 patients.
This research could provide clinicians with biomarkers they could use to better predict how an individual patient will respond to the virus. But that's not all.
The other outcome we're hoping to also obtain are the insights that are needed for better therapy in patients that are suffering from severe disease. Ultimately, we want to understand what type of immune response we need to suppress so that the patients actually can recover from severe disease.
Ongoing research is revealing more about this virus every day, but in the meantime, Dr. Iwasaki has some advice.
Even though research is showing different aspects of the immune response to the virus, we still don't have a vaccine or therapeutics that can prevent the spread of the disease. So social distancing and also washing hands and really keeping a healthy lifestyle so that your immune system is as optimal as it can be. I know this is difficult for many people because they're under such stress from this COVID-19 outbreak, but it's really important to keep a self-care